Hi everybody, my name is Vanessa Ortiz and I'm a registered nurse in the OR in PACU and in pre-op. Today I will be focusing on two different nursing trends. Number one is the use of Foley catheters for abdominoplasty surgeries, specifics in muscle repair. And then the second trend will be the use of local long-lasting anesthetics such as Exparel and telehealth use for nursing pre-op. In our plastic surgery office, we typically place Foleys for any surgery that's going to be 4 hours or more. However, for abdominoplasties with the rectus muscle repair, we place the Foley catheter, but we leave it in for 3 days post-operatively. This is done to ensure that we have urine output. We're working very, very close to the muscles and all of the tissues near the bladder. So it's something that we keep in place just to make sure that everything's working how it's supposed to and that we're having accurate I's and O's and just measuring outputs. This trend reflects how surgical nursing adapts to balance, comfort, wound healing, as well as infection control. Although it is advised for Foleys to be removed post-operatively in the PACU, we prefer in our practice to leave them in for 3 days to prevent any issues with that muscle repair. And we are very careful to monitor for any infections. We perform peri-care and are just very, very careful with those Foleys. As nurses, we are also responsible for placing the Foley catheter, monitoring, and educating the patient whenever they go home with it. Our presence across the post-op and pre-op, evidence from studies like Panucci supports tailoring catheter use to the complexity of the surgery and the individual needs of the patients, especially in procedures with higher tension in the abdominal wall. For trend 2, we're going to focus on long-acting local anesthetics and peri-operative patient education. Another trend we're using more often is the use of long-acting local anesthetics. In our practice, we use Exparel injections, and these injections are administered in the OR. This provides targeted, long-lasting pain relief up to 72 hours, and it has significantly reduced the patient's need for opiates post-op, improving recovery time and decreasing side effects like nausea and constipation. In addition to improved pain control, we also emphasize peri-operative patient education as part of our care model. Our nursing team performs telehealth phone calls or video calls to patients before surgery. We educate patients on diet, on medications, hydration, and what to expect after surgery. A lot of our patients book recovery care through outside providers, outside nurses, or just a team that's going to help take care of them. So we go into post-op instructions in detail with whoever the recovery home is. Also falls under our responsibility as nurses in our setting. These calls give patients time to ask questions, it reduces anxiety, and improves compliance with surgical instructions. We go over when to stop eating, what medications to avoid, and when to stop taking them. From a nursing standpoint, this trend combines virtual education with enhanced pain management, and it empowers and promotes a safer, smoother recovery. Both of these trends, Foley catheter management tailored to abdominoplasties with rectus repair, patient education for pre-operative procedures, as well as long-acting local anesthetics, demonstrate how nursing continues to evolve. And we play a crucial role not only in the OR, but in preparing for the surgeries.